Ladies and gentlemen, welcome to this celebration, to this party, this special occasion honouring 25 years of the work of Muntada Al Islami Trust.
Young, innocent, and with great expectations. Big ambitions for a local community, believing in helping others who are more urgent in need. Thus started the beginning of the Muntada Al Islami Trust. In 1986, the idea was developed to support local Muslim communities in the UK, helping them contribute and become valuable members of society.
As a lifetime resident here, but also someone who's been involved in the local community for many, many years, I am well aware of the wonderful things that the Trust does. I was in fact a councillor in Fulham from 1986 onwards, so I remember the foundation.
The first thing you notice when you come here is the really warm welcome and accomplished hospitality. Of course, that complies with the tenets of Islam.
One of the things that I think Al Muntada has done particularly is to build those relationships with the local community, whether that's with schools, whether it's with public institutions, teaching public servants, people locally about the Muslim religion, about the community here, or indeed whether it's about integrating with other faiths. I know a lot of interfaith work is done here.
Al Muntada Al Islami is making a better future for communities both in the UK and in Africa. Delivering schools for all ages and for all people. Providing modern education for both boys and girls. Not relying on just the national curriculum, but going beyond. Building positive personalities who become proactive and creative members of society.
Now, proudly mention that I went to Nana Khadija, and which is the first female secondary school in Ghana, and also be proud completing here and coming back to help the school in the nearest future.
Developing programs to increase the quality of teaching staff. Providing domestic and international scholarships for teachers. Employing them in areas specific to the needs of the community. Providing accommodation for students. Opening the way for students who have financial difficulties to complete their academic studies. Producing modern curriculums.
Some have completed teachers' training colleges, universities, and so forth. Many of them, many.
From these educational environments, local societies are developed. They benefit from being helped, and thus they develop into people who help others. Establishing local NGOs to cater for educational, medical, and healthcare needs. Sponsored these NGOs to support local communities to enable self-sustainable development. Thus, Al Muntada Al Islami focuses in detail in the area of capacity building, a global NGO with experience in delivering what communities need, achieving results some believe are impossible. Today, living through African societies for 25 years, our name is connected to a large number of partners. Our partners are from governmental sectors, non-governmental sectors, and local communities. We want to use our extensive and valued relationships to launch many global initiatives in the area of health and education.
The centre is doing really useful work as a bridge, trying to point the way to constructive involvement.
And I sometimes wonder how they have the capacity, not just the financial resources, but the energy and enthusiasm to do that work. All this takes an incredible commitment, both in fundraising, but also in actually boots on the ground and actually doing the work that's necessary.
This centre has been a really good friend to me, and I wish it the very best of luck for the next 25 years.
Muntada Al Islami Trust.
Since our formation in 1986, we have always stood by the poor and disadvantaged, serving as an institution that respects all.
One of the most attractive things about Muntada is that it focuses its work in Africa on the key areas needed in improving lives in Africa.
Not only are they involved in giving handouts, but they're doing health work. They're preparing people for the future. I was saying earlier on that you give fish to one person, you're only feeding for a thing. You've got to teach that person to actually fish.
25 years of people who go out into the world as well as into the local community and do good. As I said, in an absolutely colourblind, religion-blind, blind to everything except the needs and wants of people who need their support.
Values of responsibility, of patience, of perseverance, of compassion, of truthfulness, values that we see exemplified in the work of the Trust.
And they have brought hope, and they have brought future, and they have brought the needs that the poor, those without medical aid, those without education needs across the world. And it is an example to us all.
Close to home, Dirk has spoken very positively to me about aspects of your school and about his and Bella's work to improve links between the teenage boys you help and local football clubs. It is so important that the young people you encourage believe in and experience equal opportunities to participate in all aspects of British life.
But this evening, being their 25th anniversary, is particularly special, as it also is the launch, as you've heard, of the 3-year campaign to redress maternal mortality in Africa.
No ambulance, no midwife, no hospital close by. 9 out of every 1,000 children die at birth. This is the reality of life in sub-Saharan Africa. The global average is 400 deaths in every 100,000 births. 9 deaths in every 100,000 in developing countries. It hardly compares with the deaths in sub-Saharan Africa, 9 in every 1,000. The UN has set its 5th Millennium Development Goal to reduce maternal mortality by 75% by 2015. It's time we came together to reduce the pain and suffering of our mothers. This pain leaves children without mothers, affecting them for the rest of their lives. It shakes the foundations of the family fabric and structure. Muntada Al Islami understands the importance of galvanising all efforts to eradicate this crisis. We now know that over half of all maternal mortality happens in sub-Saharan Africa. We looked at the circumstances closely. We communicated with all the relevant organisations, official agencies and local partners. We looked at the issues from all angles. All our investigations led to the signing of contracts and MOUs with both governmental and non-governmental organisations working in this field. Our field research was comprehensive and complete. We forwarded immediate monetary aid to those with urgent needs. We increased medical staff. Medical tools and equipment were sourced and forwarded immediately. We have made comprehensive plans, but they address only some of the problems. Elements related to the health of mothers need urgent help and support. The door is open and the path is clear for those who want to save a life, which is precious in the sight of God. What do? They are two mothers who need help, but there's only equipment available for one. The unlucky one is sacrificed. She will probably be another maternal mortality statistic. There is little help and hope for hospitals like this, who are trying their best in difficult circumstances. Surely it's time for you to save a life, for you to participate. Safeguard these families and these societies. At Muntada Al Islami, we put our hand on the hand of all those who want to help, without discriminating against any of humanity, as taught to us in Islam. The life of a baby or a mother. Together, we can save them all.
As you've also heard, West Africa has one of the highest levels of maternal mortality in the world, accounting for more than 30% of global maternal deaths, from just 10% of the world population.
We lose every day about 26,000 people, women and children. Every 5 seconds we lose a child or a woman. Really, your work is so wonderful. I hope you can work with the United Nations agencies too, and you can be a partner with them. Thank you very much.
Lives are at risk as East Africa faces what's being described as its worst drought for decades, possibly up to 60 years. Up to 10 million people in the Horn of Africa are now affected by food shortages.
The severe drought in the Horn of Africa has reached famine.
Clean water is essential for life, but 1 in 8, around 884 million people of the world's population, do not have access to it. In Somalia, where the worst drought in 60 years affected millions, we dug more than 30 wells and water stations, providing water to more than 240,000 people and their livestock.
In March 2012, Muntada Trust, in partnership with Life for African Mothers, concluded the first training course of our innovative Train the Trainer Midwifery Development Program in Ghana. The training was delivered to over 100 midwives from 5 major hospitals in Accra, irrespective of religious or ethnic background, the only requirement being a willingness to learn and the desire to save lives. The material for this course was developed in conjunction with Cardiff University and the Liverpool School of Tropical Medicine, and the program has the full support of the Ghanaian Health Ministry and Health Service. Mrs. Mary Chun, a member of the training team, highlighted the mutual experience of development. The seminars are a skill-sharing exercise rather than a one-way channel. We learn from them as much as they learn from us. We will be expanding these courses to 4 Western African countries, Benin, Togo, Nigeria, and Mali, where our participants will go on to pass on their skills and help save lives of many more African mothers.
There is a major disease affecting Africa, hidden from view. Every year, 500,000 babies born in Africa need cardiac treatment. Each year, 60,000 of these children will need help urgently. Children with heart disease in Africa have little or no access to cardiac treatment of any kind. But there is something that can be done. A team of 10 doctors and surgeons and 16 nurses make up an international volunteer programme specialising in paediatric and cardiac care. Based in Saudi Arabia, they've been working since May 2008 and have already performed 700 life-saving operations. Cardiac surgery requires sophisticated diagnostic and surgical techniques. These skills and infrastructure are not widely available in Africa. The Muntada Al Islami Trust will work alongside this dedicated team to help bring specialist cardiac care to the African continent under the project Little Hearts in Africa. We can save lives of hundreds of children in Africa who currently have no access to cardiac treatment. Please help Muntada Al Islami Trust to deliver vital support to Little Hearts in Africa.
The Little Hearts project was formally launched in the House of Commons in front of an invited audience of royal officials, ambassadors, diplomats and health professionals from across the country. Our special guest for the night was Prince Thani Al Thani of Qatar. The night proceeded successfully as the guests gained a valuable insight into our work directly from the team of doctors. The project's activities are expected to continue and expand to other African countries, and the establishment of health institutions in these areas will be an ongoing process which we hope to continue.